Good day everyone, I am Alorosli Santiago from Nueva Ecija University of Science and Technology under BSN 3C. And here I am today to perform the Nasogastric tubing. So first, let's start with the assessment. Assess for doctor's order, client level of consciousness, and level of knowledge, and also understanding. Let's also check for availability and functionality of the needed materials. Let's also check for history of nasal surgery or deviated septum. Let's also assess the patency of NARES, determine the presence of gag reflex, assess mental status or ability to participate in the procedure. And let's move on to the planning. Before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. We are also needing to prepare the equipment, large or small bore tube, non-allergic adhesive tape 2.5 cm wide, clean gloves, water-soluble lubricant, facial tissues, glass of water, and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or meter, bilirubin lipstick, stethoscope, disposable pad or towel, clamp or plug, and a reflux valve for air vent if saline sump is used, suction apparatus, safety pin, and elastic band, CO2 detector. It is optional. Let's now move on to the implementation procedure. Introduce, solve, and verify the client's identity using agency protocol. Explain to the client what you are going to do and why is it necessary. Assist the client with a high Fowler's position if his or her health condition permits, and support the head of the pillow. Place a towel or disposable pad across the chest. Perform hand hygiene and observe appropriate infection control procedures. Apply clean gloves. Provide for client privacy. Assess the client nearest. Prepare the tube. Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off distance from the tip of the client's nose to the tip of earlobe, and then from the tip of the earlobe to the tip of the kyphoid. Mark this length with the adhesive tape if the tube does not have markings. And now let's insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water-ease insertion. Insert the tube with its natural curve over the client into the selected nose reel. Ask the client to hyperextend the neck and gently advance the tube towards the nasopharynx. If the client gags, stop the passing tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH level, which should be acidic. Confirm by X-ray. Place a stethoscope over the client epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Secure the tube by taping it the bridge of the client's nose. And for the evaluation, evaluate the patient's response to the procedure, document the procedure, and other important data on the client's chart.
Travels. Visual arts. Makeup ideas. Nursing procedures. Life journeys and lessons. Like